Oklahoma's slumping economy has put significant holes in the state's healthcare safety net. Budget cuts have already slashed state funding for a program which provides access to health care for low-income, uninsured Oklahomans. Lawmakers who examined the issue this week agree more money is needed, but say the ongoing budget crisis will make it very difficult to put more state dollars into the state's faltering health care system.
Federally qualified health centers are a vital part of Oklahoma's health care safety net. That was the message Brent Wilborn, the Director of Public Policy for the Oklahoma Primary Care Association, delivered to lawmakers during 2 interim studies at the state capitol this week. Wilborn says those privately run centers provide comprehensive medical, dental, vision, and mental health care to Oklahomans who otherwise could not afford it.
Health centers were again shouldering the burden of seeing many of the uninsured, many others as well, but health centers now seeing over 60,000 uninsured patients in the state of Oklahoma.
While the number of patients using those health centers has gone up in recent years, available revenue to provide services has steadily fallen. The centers rely on funding from a variety of sources, including the state's Uncompensated Care Fund, which is the payer of last resort for patients without health insurance. That fund has shrunk from a high of $3.9 million in 2009 to just $2.3 million this fiscal year. Susan Savage is CEO of Morton Comprehensive Health Services. Savage says when 2 mid-year revenue failures resulted in the legislature eliminating money for the Uncompensated Care Fund earlier this year, Morton felt the pain.
Most recently in August, we had to close our Bartlesville clinic for the very reasons you've heard here. A disproportionate number of uninsured patients, some unanticipated costs which added to that, and we simply could not sustain that location.
About half the patients served by Morton have no health insurance.
They make too little money to qualify on the exchange. They make too much money to qualify for Medicaid.
Savage's comments were echoed by Lou Carmichael, the CEO of Variety Care, which operates 16 sites around the state. Carmichael says revenue for those clinics comes from several sources, including Medicaid, Medicare, and private insurance, along with state funding.
All of that coming together is what makes the health center model so viable and stable. But if one part of that just falls out, like the uncompensated pool did, then it throws us into kind of a crisis mode for those health centers that are really going beyond where their federal dollars take them. That really important uncompensated pool for Variety Care represents about 5% of our budget. Doesn't sound like very much, but it's 30% of how we take care of the uninsured. So it's a very important component for us.
Carmichael says when the Uncompensated Care Fund goes down, the whole health care system is at stake.
So it's not just the uninsured who lose services, it's everyone we take care of, because we don't have different doors for different people. The continuum of care and the quality of care is delivered to every person who comes in. So that state pool is absolutely viable to all health centers, regardless of their size.
While Variety Care has not closed any of their locations, they have reduced hours at some sites.
What that resulted in is some cost savings for us, because that saved the staff that we had to have in the evenings. But what it also created was more emergency room visits, because if the patient can't go to see their primary care provider in an open access environment, then they're going to go to the ER.
That ultimately cost everyone more. A study published online last month in the American Journal of Public Health concluded that patients who receive the majority of their care at federally qualified health centers reported 33% lower spending on specialty care, 27% lower inpatient cost, and 25% fewer admissions compared to non-health center patients. Overall, total spending was 24% lower for health center patients.
So I would argue in one way, to the extent that we don't provide supporting resources for health centers to provide these services, that 24% lower spending number could be in reverse and see that 24% higher spending in other categories.
Savage says budget cuts have forced Morton to rely more heavily in recent years on private foundations to provide part of their revenue.
Their response to me over time has been, at what point will the state step back up and pick up its share of paying for services to the uninsured.
That's not likely to happen anytime soon. State Senator Kim David sits on the Senate Health and Human Services Committee.
When we got into the budget crisis last year, I was a little dismayed at how hard this committee had to fight for healthcare funding and what we were able to get. It's not sexy and it's not popular.
And Governor Mary Fallin is already warning all state agencies to anticipate another budget shortfall next year and prepare for still more budget cuts.